Good morning. We have come to a crossroads in our fight against COVID-19. And just last month, the number of new cases of COVID-19 in our community has tripled. Our hospitals are nearly full, and our health department is overwhelmed and exhausted. Our state and our region are setting new records for COVID-19 every day. Election day has come and gone, but this pandemic remains. The pandemic is not political. This disease knows no party, no race, or no religion. But this disease is winning. In St. Louis County, we have ordered everyone to wear masks to limit the number of people in gatherings or in businesses. But the number of cases continues to rise. We cannot shut our borders. We know that although we are doing better than some areas in the region, we are all affected by what happens across the state and across the country. On Thursday, we had 673 new cases of COVID-19 in St. Louis County. On Friday, we had 623. So if this rate continues, and I'm standing here a week from today, we will have 4,300 new cases. And that means, statistically, that 100 more people in St. Louis County will die from those new cases of COVID-19. And they will, because we're not doing everything in St. Louis County to stop the spread of COVID-19. No one wants to shut down our economy, and no one wants more restrictions. We understand how harmful that can be. But we can't stand by as this virus continues to rage in our community. If our hospitals fill up with COVID patients, then that means that you or your loved one may not be able to get the care that they need when they're suffering from a heart attack or involved in a motor vehicle accident. And if that happens, even more people will lose their lives. So I want to be clear with everyone. If this doesn't change a week or two from now, and we're standing here with the same rate of increase, then we will have to be considering more restrictions. We have one last chance to slow the cases of COVID-19 in our community before we are forced to take action. We are working very closely with the Pandemic Task Force and our public health officials to look at the data and determine what numbers that we would have to see before we would have more restrictions. And when we understand what those numbers are, then we will all be working diligently to avoid reaching those markers. Meanwhile, there are some actions that I'm asking everyone in St. Louis County to take immediately. First, avoid personal interactions. If you can work from home, do so. If you can conduct your business virtually, then do so. If your business and you can take care of your customers with curbside service, then do so. Remember, the safest place for everyone is at home. 2, wear a mask everywhere except with people in your household. It doesn't matter how much you trust your friends. This isn't about trust. This is about kindness and safety. And 3, to help our residents stay connected, we're asking everyone, in order to avoid threats of large outbreaks, to identify a small group, 10 people or less, that you come into regular contact with. This could be your family, perhaps other households or two, some of your friends or colleagues. And we ask that you limit your personal interactions to this group. And when you're interacting with this group, you still need to wear a mask and be socially distant. If any member of your group gets sick, then you must identify everyone in your group so they can quarantine and obtain a test. You must be able to do your own contact tracing. Why? Because our public health officials are going to be spending their time on contact tracing with our most vulnerable populations. And you or your friends and your family may not be a vulnerable person. 4, if you have participated in an event, a gathering, a wedding or funeral or party, or you've traveled, then it is our recommendation that you self-quarantine for 14 days. This will lower the risk of transmitting COVID-19 to others. No gatherings are safe, and we can't emphasize that enough. There are not enough protections in place for weddings, funerals, or parties, even a party in your own backyard, to prevent the spread of COVID-19. St. Louis County recommends that you go virtual with all of these events or wait. Our public health department learned last week that there was a Halloween party at the home of a DeSmet High School student. From that party, there are 5 DeSmet students who have tested positive. There are 2 others with symptoms who are awaiting test results. One of the students who was at the party told our health department that there were about 200 other students at the party. Another one of the students said perhaps there were less. We may never know because news of this party traveled by word of mouth. There is no guest list. Our public health department will be contacting Corey Sue and Notre Dame public health or school nurses to ask for their help in tracking individuals who may have been at this party. Every single person who went to that party needs to self-quarantine and get a COVID test. Now, more than ever, remember this: hands, face, and space. Wash your hands frequently. Wear a face mask whenever you're out, and keep at least 6 feet of space between you and others. We urge everyone to take these steps now so we can do everything possible to avoid any more public health restrictions. Do this for your community, for your friends, for your family. Thank you, and I would be glad to answer any questions.
Dr. Page, are you thinking with the restrictions, if there's more restrictions, are you talking a full stay-at-home order like in the spring, or is it kind of like a modified phase-in? Can you elaborate a little bit more about what
Well,
you might be
first of
looking at?
all, right now, I would ask everyone to voluntarily stay at home as much as possible right now. And that means work from home when possible, and conduct your business at home if possible. And we're asking people to do this voluntarily. As far as further restrictions, we'll be talking with our public health officials and our pandemic task force about what those restrictions might look like and what would have the biggest impact in slowing the spread of the virus.
Is there a particular trigger?
We're going to work those out this week. Some of the things that we look at are the same. The positivity rate in our county, which is now 10%. The rate of change of that positivity rate, and the capacity in our hospitals, and then the capacity in the ICUs. Those are some of the things that we're watching the most closely.
Dr. Page, health officials have said that, and you kind of alluded to this, the spread is coming from small gatherings in private homes, for example. Is there any restrictions that you could place that would actually be able to prevent people from gathering at homes?
No, there's not a license required to have a gathering at home. We're asking people to recognize that these are not safe. We can't police them, and we're asking people to stop doing them other than small groups of 10 or less, and in those to continue to socially distance. This is going to get more difficult moving forward as all of our activities move indoors, and this is going to be a very difficult winter.
Now, to follow up on that point, when you say avoid interactions, does that include meeting people outside like they've been doing? So you're saying people shouldn't be meeting indoors
Well,
or outdoors?
outside is better, but really we need to limit our interactions. We really need to, even outside, you need to have a mask on, you need to be 6 feet away from others, and even outside events that are, with large groups of people are not completely safe. It's better than inside, but we really need to think about whether or not we need to be doing these things.
Have you spoken with officials in the city of St. Louis, Jefferson County, and St. Charles County about whether they're going to provide or enact similar restrictions if these benchmarks aren't met?
I've spoken to a lot of our area officials, and we have been talking about all of this. We've been talking about what these restrictions might look like, and we will continue those conversations.
If they don't enact restrictions similar to St. Louis County next week, do you think that the restrictions in St.Louis County will have any effect on lowering the virus?
Well, they will certainly have a great effect on lowering the virus. They will not have as much of an effect if we're doing these alone, they will have less of an effect, but they will certainly have an effect. It is much less ideal for us to be implementing these restrictions, but we are also demographically different than the rest of the state. We are much more concentrated. We are an urban county, and so our ability to move the virus around is much different because of our density, and that's why we've taken a more aggressive approach.
Dr. Page, why do you think this is happening? Do you think that people have COVID fatigue? Is it just spreading at these small parties like Jason was referring to? What's your thought on
Yeah,
why we're seeing
I think it's all of that. People definitely have COVID fatigue, and they want to be done with it. But stopping these restrictions will not make us be done with it. This is not going away. We heard some exciting news today about a vaccine, and that vaccine is on schedule. Previously expected timeline for rollout. So we might see this implemented in high-risk folks by the end of the year. Once we get it out in the community and get a distribution network, it still takes some time for immunity to develop after that first shot and after that second shot, and then there will be a second wave for our less vulnerable populations. But we are months away from being done with the virus, and I know people want to be done with it, but that doesn't mean we can stop our restrictions, that we can be less vigilant with our restrictions. It is not going to make it any better. It's going to make it worse.
Is the proper way to put this more restrictions or lockdown?
Well, all of our restrictions moving forward will be gradual, based on the recommendations of our public health officials and working with the pandemic task force. Across the country, we saw various stages of restrictions. In St. Louis County, we limited our restrictions to non-essential businesses, but in the rest of the country, they waited too long to implement restrictions. As people got familiar with how this virus worked, and their restrictions were much more intense than ours were initially. But I hope that whatever we do more moving forward will be measured, and it will be based on where we think we can get the best effect. We're very sensitive to the economic impact of these restrictions. We also have a virus raging out of control in our community and in our country.
So perhaps not like a total stay-at-home order right away or total lockdown as was this.
We're asking people today to stay home if they can today. And that means conduct your business virtually, work from home if you're able to do that, and to provide curbside service whenever possible. We're not ready to implement these as public health orders, but we're asking people today to dial it up because we are going in the wrong direction, and we are much more urban of a county to be to not be more strict in what's happening in the rest of the state.
How could the potential restrictions affect schools and daycares?
Well, even when we had stay-at-home orders, we still allowed daycares to be open for people who had to work, and we'll look at schools the same way. A lot of the schools have stopped some of their plans to bring high school students back. Some will stop to bring middle school students back. And we've been talking to the superintendents. We can continue to meet with superintendents on a weekly basis since this pandemic began. And we're very sensitive to the needs of grade school students. And we'll be watching them more closely and trying to accommodate grade school students and students with special needs as a high-risk group, a high risk for being able to be taken care of.
I guess we probably have asked you this question 100 different times, 100 different ways. Like the county probably can put occupancy restrictions that affect schools, but they don't have the authority to say schools shut down. That's an individual school board decision. Is that basically correct?
That's basically right, but we're not, just about every business sector and industry we interact with, we have these conversations and we come up with a safe path forward that works for everyone, that keeps people as safe as possible. And we'll continue these conversations with schools. We have a great partnership with the schools, and we intend to keep that.
Dr. Page, how frustrating is it for you that these parties like that, this nut one, keep happening?
Well, it's frustrating for everyone. It's frustrating for our country. Everyone is touched by COVID. No one is spared. People have lost their lives, and many more people will lose their lives moving forward. It's been devastating for our country. People are losing their businesses, folks are losing jobs, Schools are disrupted. Everyone's life is disrupted. And so everyone is frustrated. You know, the medical community is frustrated. This is a real challenge for our community historically and our country. And we have to work through this the best we can and recognize that frustration is normal. And we're all going to talk about it, and we're going to work through it.
Is there any sense of like what these, we kind of talked about the restrictions in a vacuum, are there any specifics that you would potentially put into place if things don't improve in a week?
Oh, we're not ready to talk about specifics yet, but you know, everything that we've seen across the country and across our community is within the realm of possibility. We're going to try and be thoughtful. We're going to try and be measured, but we clearly can't keep doing the same thing that we've been doing and expect anything to change. That's not going to happen.
So we don't have a timeline, whether it's a week or two, or just sometime?
I would say within a week or two,
Okay.
if this curve doesn't bend, or at least plateau, then we're going to have to do some things differently. Our hospitals can't continue this pace, and this loss of life is not acceptable.
Is the county able to fine or punish people that host alleged parties like you were talking about with the high school student?
You know, we can look at that. I'm not sure that we have the ability under current county ordinances. It's, you know, and I don't know how common these sort of things are, but they're clearly devastating. I mean, this is a super spreader event, and we need to stop these things. They need to end. And we need everybody in the community to do their part. We just don't have the time or the ability to police every backyard gathering. We have a pandemic on our hands. We're trying to focus our energy on vulnerable populations. We're trying to deliver emergency services into the community, to get testing into the community, and to support our hospitals. And we don't have time to, or the ability to police all of these private parties.
Is it safe to say your contact tracers are very overwhelmed right now?
The contact tracers across our community, across our state, across our country are absolutely overwhelmed. And we know from all of our public health recommendations across the country that if you have more than 10 cases per 100,000 in a community, then contact tracing becomes much less effective. And we're well over 50 cases per 100,000 right now. And contact tracing is going to be much less effective in this type of environment. That's why we have to triage and focus on our most vulnerable people and our most vulnerable populations.
Dr. McDade, you're right. You called that Smith party a super spreader?
Yes. Now, that was not a school-sanctioned event, in all
Privately
fairness.
held party.
This is a typical individual choice, news spread by word of mouth, and this is typical of some of the events that we're seeing in our community. It is not the policy of our public health department to give out details that might identify individuals or organizations unless we are unable to contact those individuals any other way. And there was no guest list. There's no way to know who was there, and that's why our public health department has to disclose what happened and try and get the word out the same way the word got out about the party. The word has to get out through word of mouth that if you're at this party, you need to get tested and you need to quarantine.
What would you say to residents that view the pandemic, the herd immunity as the way through the virus?
Herd immunity is 6 months or 9 months away. Other than that, herd immunity is a myth. It's an excuse to not do the right thing. It's not reality. It's a political argument. And we have a vaccine that's on its normal timeline to be available to help us get through this. And nothing's going to be normal until we have that vaccine. And the initial results from the clinical trials are very promising. But you know, even when the vaccine is available, when it's delivered, which is a couple of months away to start getting it out in the community, it's going to go to a more limited group, first responders, public health workers, high-risk individuals first. It takes time for them to develop immunity after their first and second injection, which has to be spaced out in time. And then we'll have a second round of vaccinations for folks that are less vulnerable. But rolling out this vaccine takes some time. Spreading this through the community in a purposeful way will leave us with an extraordinary loss of life. It's just not what this country does.
The parents in that mess situation couldn't be charged?
I don't believe that we have any current ordinances that would allow us to charge them. I haven't talked to our public health department or our county attorneys about that. I think moving forward, everybody just needs to learn from this. Any other questions? Okay, thank you.